far you have come on your own, but never alone. Through the rain and through the shine, here's your moment, it's your time. You stood tall and now you see, standing in your destiny. 100 women growing strong. 100 women where you belong. You stood tall and now you see, you have reached your destiny. Woman.
As people of African descent, we offer this land recognition in solidarity with the indigenous peoples of Turtle Island in the efforts and deliberate intentions toward decolonization. As people of African descent, we acknowledge the land of Turtle Island that sustains us, express deep gratitude to its indigenous peoples, and pledge to honor our dignity and divinity that ultimately connects us all. By Kay Johnson. Welcome to 100 ABC Fireside Chats. 100 Accomplished Black Canadian Women is a bold project initiated by co-authors and co-founders, the Honorable Dr. Jean Augustine, Dr. Denise O'Neill Green, and Donna Jones Simmons. Our mission is to celebrate and archive the professional accomplishments of trailblazing Black women from all across Canada. The goal is to create an ever-expanding database available for current and future generations via print media, public and private libraries, as well as our website, which is www.100abcwomen.ca. In addition to our fireside chats on topics that matter to our communities, such as education, healthcare, entertainment, creative arts, trade union, and so much more, we offer biennial book launching galas and biannual symposiums. The co-authors and co-founders would like to take this opportunity to thank each of you for attending today's fireside chat. We know that you will find these sessions educational and inspirational. So sit back, relax, and hear from our brilliant and talented honorees.
Hello and welcome to another episode of 100 ABC Women's Fireside Chats. In this episode, we're going to be talking about mental health and housing insecurity. According to StatsCan's data from the Canadian Social Survey, Quality of Life, Health and Housing Costs, collected from August 2nd to September 15th, 2024, nearly half, that's 45% of Canadians, are concerned about their housing affordability. Previous research has shown that more than 1 in 5 Canadian households were living in unaffordable housing. That means they spent more than 30% of their income on shelter costs, and that's in 2022. So at a time when the number of unhoused or underhoused or poorly housed Canadians is growing, and support for individuals with mental health challenges is still underfunded, this conversation is quite timely, and we have the perfect guests for this conversation. Kayla M. Stevenson is an adjudicator in municipal tribunals. She's an award-winning mediator and arbitrator, mainly in family law. With over 17 years of legal experience, Kayla has passion for racial equity, social justice, advocacy, and access to justice. Kayla is also a 2024 100 ABC Women honoree. Welcome, Kayla. We also have Angela Carter. Angela Carter is the retired executive director of Roots Community Services, where she still contributes as an advisor strategic initiatives. Angela is a well-known champion of the Black, African, and Caribbean communities and a very strong advocate for racial and social justice. And Angela is also a 2024 100 ABC Women honoree. Welcome, Angela.
Thank you.
So I'm going to start with you, Angela. I'm going to ask both of you to give our audience a sense of the kind of work you do in this area of housing insecurity and mental health. Angela, tell us about Roots Community Services.
Thank you very much, Sarah. And it's a pleasure to be here to talk to you along with Kayla. And about Roots Community Services, we are an organization based in the region of Peel. We're offering services to primarily Black, African, and Caribbean communities for the last almost 40 years. We were once the United Achievers Community Services, and we changed our name back in 2019 as we, changed direction and really looked at what we were doing within the community. And we offer programs to individuals from age 6 right through to seniors. So we have a wide range of programs we offer, and that includes men, women, families, right, as well. So we and youth and men. A lot of the work we do is in counseling. We counsel, and I don't always use say mental health. We say for people who have sometimes the inability to cope with a situation at that time, because mental health is on a large spectrum, as we know, right? From not being able to cope to really when you have the diagnosis of a real mental health disorder or area. So we do a lot of the counseling from the helping people to cope and to be able to have the tools and techniques and have the confidence and stuff to get back to be able to manage on their own and to manage their day-to-day work in a healthy way. When it comes to housing, housing is one of the major factors that's affecting people's mental health. It's one of the social determinants of health. And so, poverty, racism, discrimination, ageism, all of these things, housing insecurity, food insecurity, they all affect people in various ways. But not having a house is one of the big things, because when you don't have a house, you're applying for a job, you don't have an address to give, it's a ripple effect for people. So it is a major concern for many of our clients. We see youth who are couch surfing, right? They're not going to school because, again, they don't have stability in the housing, they don't have stability in certain areas. Their mental well-being they're not well. So we see it in a number of different areas. We see people who are working having problems with housing security because some of them are sleeping in their cars. Why? Because they can't afford to pay rent on what they're working on. They just can't afford it. So there are so many different stories that we see, and housing and employment, they go hand in hand. And as we say, the housing security and insecurity and mental health is a bidirectional issue. They're intertwined. One influences the other. So, so we do a lot of that. Council, we do connection. We work with the region appeal, the various levels of government, but primarily the region appeal when it comes to housing. We actually have a program with the region of appeal called the Community Agency Subsidy Program that started in 2023, which is part of the Housing First initiative that's across the country, but from here in Ontario. And this is helping people to gain some stability, providing them some income to gain some stability when they have that instability, and helping them that they can keep their jobs and to be able to maintain certain things and relieve them of that stress of not having sufficient funds to pay. So that is what we do in a nutshell.
Yeah.
We do a lot more, but we offer a lot. What I should say, we offer a lot of wraparound services too.
Yes.
So we don't just deal with one issue. We try to help that family, that person, with a number of different areas. So we try to connect them with or provide them with other services that we offer as well within our organization.
Thanks very much for that. And I like the fact that you look at it holistically and your organization has that holistic approach. Now, Angela, you're an adjudicator with municipal tribunals. So can you tell us about the work that you do with tenants and landlords?
Let's Kayla.
Oh, Kayla, I'm sorry.
Not a
Yes,
problem
Kayla, sorry. Yeah.
so much.
Mhm.
And thank you for that wonderful introduction. It's a pleasure to be here with the both of you. So your question was that I am an adjudicator. I am.
Mhm.
I'm also a mediator. So I mediate from a trauma-informed lens, tenant disputes, and that's what I do.
Mhm. And so typically, what does that look like? What are the different scenarios that you see in your practice?
So people come to me to assist them with mediating for them to stay in their unit when with their landlords. So sometimes it's landlords that own the property, and sometimes it's subsidized housing in co-ops. That's where I do some mediation in cooperative places.
Mhm. So you sort of come in when the problem has gotten to the point where the tenant is likely to be kicked out.
They're
What
about to
are
go
you?
to the landlord and tenant board. So sometimes they go to the landlord and tenant board, and they need mediation intervention, or they're about to go there and they want to try to mediate to see if they could stay in their unit. And I
Mhm.
sometimes have landlords as well.
Mhm. So, question to both of you. What is the difference between homelessness and housing insecurity? I'm sure I'm not the only one who sort of is wondering about, what would the definition be? And Angela sort of alluded to some of the scenarios. Either one of you.
Okay. For us, homelessness is, well, you have no home, really. You have no place to go, and you sleep on wherever, right? So you is no fixed place of abode, where you have that, right? That's it. Housing insecurity is that you're in a situation where it's precarious. You can lose your housing at any time for a number of reasons, that you are unable to pay your rent on time. So you are either paying rent this month or half of it this time, and then next time because you don't have sufficient funds to pay that. You're jockeying with other things that are priority. Could be medication, it could be food, it could be other things. The housing insecurity could be that you don't have enough and you're where you are right now. The landlord is trying to get you out for some reason or the other. Or it could be that the landlord is not fixing the place and you're living in an untenable situation, but you really don't have anywhere to go. But you have to now make a decision between, do I stay or do I really go out there and try to find another place that probably I can't find because I can't afford it, or go homeless, right? So because there are situations where the landlord, and not all landlords are bad, because I understand some landlords, this, having a rental is for them, for their livelihood as well. And there's some of them that are really doing very well and really care about their tenants. But there's an issue, we've had a client where she's in the basement apartment. The landlord, every time the landlord uses a shower, uses the toilet or so, it comes down into her shower, through her shower, right? So there's a stench. She's tried to speak to them about the plumbing. They're telling her that she bathes too often. She shouldn't be taking showers that often. 3 times a week is enough, right? So that kind of stuff, that is housing insecurity. She might have a house, but how secure is it? She can be out at any moment. So these are the kind of things that leads to housing insecurity. But homelessness is when you're homeless. You
Yeah.
really have no place. You go into shelter. You depend on the shelter and stuff like that.
Kayla?
Angela did an excellent job explaining that. So yeah, housing insecurity, you are at the brink of losing your housing, or there are some issues, and then homelessness is when you don't have a place to live at all.
Okay, great. Now that we're clear on that, somebody has a comment about co-op.
Yes.
Yes. Yes. So to clarify, members in co-ops are not all on subsidy.
Absolutely.
Yeah. And I don't think that's what the panelist meant to say. And the ones that end up before the tenant board, right?
Right.
I think
So
that was for you, Kayla.
yeah, definitely. So co-ops, I didn't mean to say that if I did, that co-ops, everybody in a co-op are on subsidy. I said subsidy, and I deal with co-ops, which is different.
Yeah.
And definitely co-ops are non-for-profit, and they do have subsidized and non-subsidized members. Everybody has access to mediation. So I mediate for everybody. Those are my comments for that. Thank you.
Yeah, thank you very much to the audience member who sought to clarify that. Okay, I'm just trying to move this up. Okay. All right. So how much weight does housing carry in terms of being a social determinant of well-being? And Angela she sort of answered that question originally. But in this day and age, when there housing shortages countrywide, so how much weight does that carry on mental health?
I think it's a lot,
Okay. Go on.
sorry,
Go on.
Angela. I think it's a lot. When you don't have a place to live, it doesn't matter if you have a job. It doesn't matter, if you don't have a car, a place to get, where you can go to and from. If you don't have a place to call home, that affects your mental health largely.
Angela?
Yes, I agree. I agree with Kayla. It is difficult, really, when you don't have that stability is so important in our lives. So when something as fundamental as housing, you don't have that, you are going to be not mentally well. You're going to have, it's going to be stressful. It's going to bear on you, because you're going to think, even if you have a job, what does it mean? You may lose your job. You're not going to do well at your work, and that might cause you then to lose your job. That makes the situation worse. Right? So as I said, it's really very much bi-directional. That's why I said that earlier, because one influences the other in a big way. And we need to think about that, about when we're looking at the issue, and when we're looking at interventions, we need to think about what works and what wouldn't work, and why these things happen. So it's almost like a vicious cycle, right? So poor mental health can lead to housing instability, which in turns worsen your mental health. And then that not having a stable housing can, right, lead to, is a stressor that can lead to you losing your house. So what do you do? How can you mitigate that? How can you overcome that? Right. We need integrated solutions. It's not a matter of trying to fix one thing and not the other. They must be done together.
I
agree.
Kayla, based on your experience with the Landlord and Tenant Board in Ontario, what are some of the key issues that tenants and landlords face? And Angela alluded to one scenario. And then how can mediation improve outcomes for individuals who are dealing with mental health challenges?
Okay, so I just want to clarify, I am an adjudicator, but I'm not an adjudicator for the landlord and tenant board. I do mediation for landlord and tenants, and I'm familiar with the landlord and tenant board. So your question was, can you
No,
just
based on your experience.
Mhm.
Yeah, coming before the landlord and
Yeah,
tenant board.
and go on. What was the question?
No, the question is, some of the issues
Come on.
that you see when you go before this board, and then how mediation can improve the outcomes for people who are having these challenges with their mental health.
One of the issues that I have seen that would go before the landlord and tenant board is that a person is being evicted because they are hoarding. So there's a number of items in their unit that makes it inhabitable for the person, and fire hazards. Um, how mediation my mediation would help. So any mediation could help, but I mentioned earlier that I offer trauma-informed mediation, is where I could, get into some of the reasons why this is happening. Not everything is the way that it looks on the face of it. And mediation could kind of help the landlord try to understand that this is a fixable problem or can be a fixable problem, and to be able to kind of move forward while having that person still have their housing.
For people who have never watched the show Hoarders, do you remember that show? So what are the kinds of interventions that are possible to help mitigate, uh, potential eviction?
With regards to hoarding,
Yeah.
um, therapy.
hmm
Therapy, counseling, can be some things that one can go to in order to help them through their issues that are causing the hoarding.
And what kinds of things have you seen, or that would cause people to become hoarders or be hoarding in their unit or living space?
Um, some of the things that I've seen is that, some people have things that happen to them when they were younger, or as an adult, and these are traumatic experiences. And one avenue is to hoard things. That's what I've seen.
Angela?
Yeah, and yes, following on what Kayla said, the hoarding is a symptom in many cases. It's so trying to get to the underlying cause of that hoarding to help that person. So yes, therapy for sure, and the counseling and providing that wraparound service, so you need to look at that person holistically and figure out why do you hoard? The person might think that they need to hold on to these things because it's life sustaining for them. It's a survival mechanism for them. So that's why they're holding on to these, because very often it's nothing. They feel if they throw away something, they're throwing away a part of their lives. It could be. So how do you get to the bottom of that? Right? You need to work with it. It could take a long time to work through depending on the issue, what's causing that. But that is so you need therapy, you need understanding landlord, you need to have support. So it is a complex issue. It's not just one, try to fix one aspect of it. You need that whole support system, various aspects to come together to work with this person to help them to find a solution that would work. That will take time. So you need people that's going to walk along with that person.
And sometimes, just piggybacking on to what Angela says, for, Black people or people of color, we don't have access to these support systems. We don't know where to go. We don't know, who to reach out to, what to do. And sometimes when you don't have that, all of those things that Angela said, a supportive landlord, a support system, an agency that you can go to, a mediator to kind of assist, that's when people get housing insecurity and homeless.
Mm-hmm.
Yeah, and quite correct. And that's what one of the things we do at Roots Community Services. We connect people as well. We do a lot of, they said, the counseling, but when it's beyond our reach for psychiatrists, we don't have a psychiatrist, but we can connect them to psychiatrists or one of the other agencies that we work with, to help them. We work with CMHA as well as CAMH, that the Canadian Mental Health Association, as well as the Canadian Association of Mental Health, and one of the things we are happy about is that, we have proposed, along with some other partners, the Black Health and Social Services Hub, which is going to bring a lot of those functions, I should say, under one roof, that you can get that seamless type of support you need through our partnerships, and we can be able to support especially Black, African, and Caribbean communities really holistically.
Mm-hmm. Because of course, in our community, first of all, there's shame associated
Stigma.
with, sort of the semblance of lack of control in letting the problem get to the point where you're almost losing, where you live. And I think you've sort of answered this question, but an audience member would like you, Angela, to expand on the integration. You talked
Okay.
about wraparound
Talk about
services to support individuals.
So one of the major ones, I don't know if people have heard about the Housing First program that's here it's across Canada, but also I talk about Ontario. And that Housing First program was something that was developed for this reason. It's an approach that let me just read it here so you get it. It's a recovery-oriented approach to addressing housing risk that centers on quickly moving people experiencing housing risk or homelessness into independent, stable, permanent housing while providing concentrated supports and services as needed. That's what it stands for. Of course, because we have this dearth of housing is a problem, but it has been instrumental in helping to provide that stability because it comes with limited conditions. So you don't have to go through a whole long list when, if you're going to apply normally for an apartment, you have to give up your firstborn and everything else because they need everything about you and before they, you can be rented. This one has, right, there's limited conditions that you have to go through to get that housing, but it's coupled with supportive services. So that integration comes in. You don't just get a house. It helps that person to, what are the other things that they're facing? Is it employment? Is it mental health issue, a mental health problem such as schizophrenia or bipolar, or one of those major ones that cause people to, that they need to have medication for, is beyond just coping on day to day. It is really a disorder. So how can we work with? Probably shouldn't use the word disorder. They've moved away from using disorder with mental health. I should say that they don't like to use that. So how can you really work with people who have these this mental health issue? We need to provide them with counselors. We need to provide them with people who can work through those problems with them, provide the medication that is required at that time, work with them to ensure that they're taking their medication. And when they do, they can live a pretty good life. So is providing that type of support, connecting them with peers, connecting them to other supports with their other social services. We talk about, excuse me, I'm over getting over a cold, so I keep clearing my throat. I'm sorry about that. So how can we connect men? We can look at men that don't like to talk about their feelings. They don't like to get them in a men's group. We have a program called Black Men Speak Up. Get them connected so they can listen and talk to other men. We have a youth program, right? So how can you get them into the youth program where they have peers they can talk to and see others that have overcome some of the things that they may be struggling with? We have a women's program. A lot of the women's problems, and Kayla talk about that. Many of them, because they are in intimate partner violence, they've experienced that, they've left their partner, or they're maybe still in an abusive situation, or they're struggling on their own. We have programs for them that they can talk to others that are experiencing similar thing, get that group support. So having those support mechanisms around, having a counselor that you can talk to when you're really feeling that, down or you need some help, that can give you tools. Those are the kind of integrated support. So it can't be just, oh, I'm going to put you in a house. That's not always, because sometimes people just fall way back into where they were before.
Kayla, when you appear before tribunals, how are people with mental health challenges like schizophrenia and um, what's the other one that you mentioned? But
Bipolar.
different bipolar disorder, etc. Like, how are they treated as potential tenants or current tenants?
So I don't have any experience with that.
Hmm.
I don't. But as an adjudicator myself, I would take that into consideration when I am, making a decision when those things are presented to me.
Hmm.
So whether if they are diagnosed, whether they have some supports, um, because some people are diagnosed and they don't have community supports, and what they're doing to assist themselves, you know.
Hmm. Somebody in the audience said that with regard to the hoarding, for example, the person has to want to be helped. You
Yeah.
you can't sort of shove it down their throat as well. That's a very, very valid point. So you can have all the integration, all the support systems available, but if the person doesn't want to avail themselves of it or is unable to for whatever reason, then so
And
Kayla,
that is true for any
yes,
kind of support
yeah,
that, person must want to have it. And you offer, and it's up to them to take it. But
yeah,
that, yes, yeah.
yeah.
Believe it or not, that works for mediation as well. All parties need to be willing. No one is forced into
Yeah.
mediation
Mhm.
unless an adjudicator orders that you go and try it. But you're not binded to do it on your own unless you agree.
So
And
Kayla,
sometimes it takes like 2 to 3 years for somebody to come back to take that opportunity that was offered to them.
exactly, exactly. So Kayla, we'll stay with you. Can you talk to us about how systemic inequity, especially as it relates to Black women, how that exacerbates challenges surrounding mental health and housing insecurity?
Okay, so Black women all often face intersecting forms of systemic inequity, including racial, gender, economic discrimination. These inequities, they manifest in higher rates of poverty, limited access to mental health services sometimes, and overrepresentation in low-income housing. When mental health challenges like hoarding arise, these systemic barriers reduce the likelihood of early intervention and support. So mainly you're going to be right at the end when, your house is, you're going to be evicted. And then it's just now that, some of these women would be getting some intervention. Um, Stereotypes and biases make them less likely to receive empathy or support from landlords and housing authorities. And cultural stigmas surrounding mental health can deter some young women or Black women from seeking help, and that's further perpetuating the cycle of housing insecurity. So
How,
as a mediator and adjudicator, sorry, Sarah, I don't want to cut you off. Go
no,
ahead.
no, no, keep going.
Okay, I've observed how these systemic factors influence decision-making in housing disputes, and advocacy for culturally aware policies and trauma-informed approaches is essential to addressing these insecurities.
Can you talk to us some more about the cultural factors that come into play?
When it comes to
No, these systemic issues, systemic discrimination against Black women in particular.
so the cultural
Yeah,
factor,
yeah.
um, um, some
What do you see?
they don't like to talk about it. So
Yeah.
nobody likes to talk about it.
Mm-hmm.
So it's hard to be able to assist somebody or help somebody or get to understand what their path was like when they
Mm-hmm.
don't like to talk about it. So in my position as a mediator, I would try to get them to open up by maybe saying some things about myself, so that they feel more comfortable, and that they trust me to help them. Because sometimes as well, Black women go to supports and they're untrustworthy supports. So they
Mm-hmm.
get the wrong information, wrong legal information, wrong information, and they get kind of put somewhere else. So I make it a point when I have people mediating with me to be open, honest, and show them that it's a safe space for them to be able to communicate.
Mm-hmm. Angela?
Yes, Kelly made some very great points there because I also have that as well. That culturally sensitive and appropriate type of counseling and interaction is very often key to a person seeking help or accepting the help, because when we know within our culture that the healthcare system has not been very supportive of us, we don't get proper access. We're dismissed when we go places as well. We are considered that we somehow they seem to think that we can bear more pain than anyone else. All of these, there are so many different factors, and we go because we sometimes have no choice, but we don't really believe or trust what we're hearing in a number of cases. And that's what we try to do. Like Kayla said, we open up and let them know, hey, we are you. We are like you. We are with you. We are walking alongside you. Um, you know, we can help. We will help you, and use some of the personnel to help them to see, yes, we understand where you're coming from, and that way, and provide them that counseling from a cultural lens. We have adapted a lot of the counseling to be focused on Black, African, and Caribbean communities. And our counselors are from the communities, so we can really relate and share our lived experiences if we have to help. And it helps in a number of ways because we can walk with them. Sometimes we have walked in their shoes as well. So, in their footsteps. And we've done that. So we get them to open up. And that's how we can get them to really start helping themselves, because a number of times, except for when it's really as a situation that needs medication and stuff, so some people have some of the answers. They just don't have the guidance or the know-how of how to make those put those things in place. So we work with them and walk with them and connect them.
Mm-hmm. Were you going to say something, Kayla? No, okay. So I'd like to, I know the topic is mental health and housing insecurity, but I want to get back to housing insecurity specifically and the different populations involved and how housing insecurity affects them. And the populations I'm interested in especially are students, seniors, and refugees or asylum seekers. What would you like to say about that? And what you've seen, what your experience has been, either in your practice, Kayla, or Angela, in with your organization.
Okay. With regards to students, especially international students, we've known that many of them have been housed in rooms, in basement rooms, bedrooms, like 6 or 8 to a room, in a number of cases where the landlord is maximizing as much as possible, and they can't go anywhere else because the rents are so high, and they didn't factor in that. Uh, you know, so and that is the international students especially. So that is housing insecurity, and that is leading, unfortunately, it's led to a number of students getting pregnant because they're mixed with both boys and men and women. Some of them getting pregnant here and have, then, that is another issue in itself. Many of them end up with mental health issues and have to come for counseling. And so those are the issues with international students. And I know some of our partner organizations have developed a guide for international students, and that are here with that. So from an international students perspective, with regards to seniors, yes, seniors, they're living on fixed income. Their income don't change like the inflation and how things are going. What we try to do within our organization, and what we do not try to do, what we do is help seniors to find those benefits that are there, because there are benefits that sometimes they don't know of. So they're government benefits. We try to find those, like the free tax clinics. We offer a free tax clinic each year, and we support seniors in our community. Within the region of Peel, seniors have in Brampton can travel free on the buses, and Mississauga, I think theirs is a reduced fare. So those are things. So we look for benefits that are there and tell them about them so that they can participate and reduce the costs that they have to face. Their meals and stuff, we help to connect them to various places as well. So we do a lot of that connecting for them to be able to find things that can be sustainable, but that are culturally relevant as well, because again, being able to eat the foods and stuff that they're accustomed to is a big thing. We know is very big in our culture. And with regards to you said the asylum seekers, yes, and I know for many of you would have seen in the last 2 years or so the influx of the asylum seekers coming primarily from African countries, and them sleeping outside shelters and stuff like that, which was really, really unfortunate. And the community really stepped in. Yes, the government did not do as good a job as it could have done. They have stepped up in a big way now, but the community stepped in to support. Um, what was unfortunate, what a lot of people didn't know about the asylum seekers that came in, because they were comparing them to other ethnic groups that came here. But the asylum seekers, a lot of them came on visitor visas. And when they got here, they sought asylum. So there wasn't that the government was prepared or the municipalities were prepared for them. It was that when they got here, they sought asylum. And that caused, and because with such a large number, it really overstretched the shelters. Did the government act quickly enough? Probably not, but they did step in. And I know here in the region of Peel, we were meeting weekly to try to get ahead of this problem. But we did push the government really hard on it, because when people started to die, that was really becoming, that was, yes. So we did, and things have happened. There's a lot of changes, a lot of things put in place for that. So organizations like ours are helping with, especially from a counseling perspective, to help them, because mental health is, of course, that stress on them and not finding shelter and not being able to work and not being able to be processed as quickly as possible in the initial stages, those were all factors. the situation has eased quite a bit. There are not that many people in the shelters. It's coming down, and not what we're seeing now is an influx of other ethnic groups. But that is a major concern, and it's going to continue for a while because there are quite a few people that came, helping them again, counseling, wraparound services, finding jobs, finding
Information.
information, and then some of them have to go to other jurisdictions because not everyone can be housed here because the housing situation is awful in our
Exactly.
region right now.
And you've seen what's happening in my province of Quebec, where
Yes.
our premier has been complaining very loudly to the federal government that
Yes.
no, all of the people that came across the border
Yes.
in the
Yes.
wake of the first Trump administration
Yes.
and were massed along the border between New York and Quebec
Yes.
should be just sent across the country and shipped off wherever, but away from Quebec. So yeah,
Yes.
I hear what you're saying. So
Yes.
Kayla,
I just
with
wanted to add,
yeah,
sorry, I just wanted to add just quickly to what Angela said and jump back in quickly to the seniors. So something that
yes,
just came before me was the lack of accessible units.
yes.
So seniors need some accessibility in their units, and there is, believe it or not that many units where a senior can be independent but live with their accessibility issues, and that causes them to experience housing insecurity.
Interesting. So what, like, secure, accessible housing looks like what? Like, what are the kinds of things they're not finding where they're
Um,
living?
so if there is someone that can live independently, that's an elderly person, a senior citizen, they are not able to, if they have a wheelchair, there's not very many wheelchair accessible units,
Hmm.
even in seniors, because there's some high-rise seniors buildings as well. Um, yes, I see in the chat that ADOA is a requirement in rentals, but sometimes that requirement can be only for a specific number of units that can be occupied by some that are not senior citizens that equally need accessibility units.
Hmm. And of course, ramps and things like that, and accessible bathrooms and that sort of thing. Yeah. And so what have you seen with regards to students, for example?
Not much,
No?
not much.
Mhm.
I've heard a lot, and a lot of what Angela said is those things I've heard. And it's great that there are some of these community organizations that help support students and newcomers because they do experience a lot of challenges.
So in the chat, someone says that veterans in Canada are at risk of mental health issues, substance abuse, and homelessness, and the federal government does have programs to help veterans experiencing or who are at risk of experiencing homelessness. Yes, veterans. That's a whole other veterans, either the elderly ones or recent ones, especially the ones with PTSD. Have you seen cases at all with our veterans?
Well, I previously worked for Veterans Affairs Canada a long, long time ago, so I'm very familiar with some of the issues that they have when they're not serving and they're trying to find access to services. This was quite some time ago, so there's a lot of services out there for them for veterans now. Um,
There's services, but what I've also heard is the long wait times to
yes.
access those services, and apparently it's gotten worse. And also the lack of funding. Some services actually getting cut because, with new governments coming in and having to shrink their public spending, for whatever reason, somebody thinks it's a good idea to be cutting there as well.
Yeah.
So anything else you'd like to add specifically with regard to the mental health and housing insecurity issue?
You know, as I said before, as I say, it's bi-directional, and wanted, you know, that so it's an it has to it cannot be tackled individually, and there are a number of different areas we have to look at. I was looking at the chat and I saw someone talk about the intergenerational, so many people living in one unit and they have to look
Yes.
at that and stuff.
Mm-hmm.
Yes, there's a lot of that, but when you find, if you have a mother, I used an example, a mother that is working two jobs, two jobs to make ends meet. There's no father. There's a grandmother. There's the mother's there, but she cannot work, right? Because for whatever reason, she's not working. So she assists and help with the kids. This mother has about 3 kids in school. So she's happy to have the grandmother there because with working the 2, 3 jobs, that, you know, that can barely manage then the 5 of them. So, you know, that is intergenerational. But the money she's making is not enough to cover for all of them. So what do you do in a case like that? You know, that person needs to probably rely on going to the food bank to get food to supplement them. That thing, but or may not go because they're embarrassed. The stigma that is there for that kind of stuff for them to go, they don't want to go. They may end up now because if that mother is working 2 jobs or so, and the grandmother's thing, something might happen. The grandmother might be have early dementia or having dementia. How is that person coping? Now the children might go to school and say something, right, to the school, a teacher because of something, and said, oh, my mom was working and my grandmother couldn't help me because she wasn't whatever. The teacher called children's aid for that child, for that family. I mean, so all of these things are things that people think. We had a case where, because we work very closely with Children's Aid Society as well, and we had a case where a teacher sent a family to Children's Aid because that child was bringing to school rotis 2 days a week or 3 days a week, a roti that we know is a meal in itself. And the teacher didn't know, but they said it was neglect. So they called it Children's Aid, right? So these are the things when parents have to think about this. Now, this mother has to leave work and go deal with Children's Aid. They're working in a job where that if they're not there, they're not getting paid. All of that is adding to a person's mental health,
Yeah.
right? Which is going to
And
affect them, right? Which can then, if they don't have the money to pay, they're going to lose their housing. It is so intertwined.
Kayla?
yeah, it just adds up, you know, that brings the stress, the trauma, and all of those things start coming out. And then, you know, maybe in a situation like that, that was an excellent situation, Angela, where you can see the layers. Something
Yeah.
comes out, well, I have to, you know, withhold my rent this month because I have to pay for somebody to watch my mom and I have to pay for somebody to watch my kids. And then, you know, things start, you know, building up, unfolding. That was such a great
Yeah,
example.
that's a very good example, especially at a time when, because of the housing, the scarcity of affordable housing, a lot of parents are having to take in their parents, their senior parents, and their kids, their young adult or adult kids, and their kids probably as well.
Yeah, because I was actually just talking to someone the other day. This is a couple,
Mm-hmm.
husband and wife, they're working, and they're upset with the federal government and stuff because they had to move back home. They couldn't afford their house anymore. They had to move back with her parents. So, I mean, and this is a couple that's working,
Mm-hmm.
and they were upset they had to move back home with their parents.
Speaking of which, because we are in pre-election season, there's about to be an election in your province, in Ontario, and there's about to be an election federally.
Federally, yeah.
Yes. And there's a lot of talk, all the different candidates are talking about, oh, housing and housing affordability and all of this. Who's responsible for housing? What level of government is responsible for what?
It's not as easy as some people think. Well,
Mm,
funding comes from the federal government into the provincial governments,
mhm,
right? So the provincial government's really the ones that would determine the build out or the not, the expansion or reduction in the housing normally. I know that because of some of the issues recently, the federal government went directly to municipalities, which the provincial governments don't like that, of course. But but really, it's the municipalities working with the provincial governments that's really to build out the housing part of it, with funding that comes from federal government. So it's complex, it's layered. But what we're seeing now, for me, is lack of planning from 10, 15 years ago. It isn't that you just don't get a dearth of housing just like that. It is not well planned from years ago. The immigration policies, because if we are going to invite a number of people to come into our country, we need to have housing for them. So I'm not saying stop immigration, because we need immigration, right? But was it well thought out between the federal government and the provincial governments and the municipalities as to how this is going to work? If we're getting these people coming in, where where are they going to stay? If we're attracting international students, where are they going to stay? And if we're planning so many per year over the next 5, 10 years, don't you think you need to start planning from now to get the houses? You know, that's it. That's my own take on it. Some people may not agree, but I think it's lack of planning.
mhm.
And then
Kayla?
now everybody's jumping and say, oh, we need to get housing, we need to get housing. We don't have enough tradespeople to work in the housing, because you can't get, if you have 200 people, you can't clone them to build all of these houses that you're supposed to get.
Kayla?
I agree with what Angela said. I feel that there's just a lot of people coming in. Plus, we have the people that are here, and there's not enough housing for all of us.
Hmm. Somebody had a good comment here about people with disabilities. Is that when seniors rather, seniors who live in co-ops and whose housing needs change and who would like to adapt their units or their homes to their changing needs and doing it to code. What are their rights?
So I've seen in co-op housing where, they originally received a unit that wasn't an accessibility unit, and their accessibility needs change. They've been living there for a long time, and they need things. So the ADOA comes into place, and the co-op needs to abide by that. So if they are saying that they have these accessibility issues, the co-op is to provide those accessibility needs. So they received a ramp. So they would have stairs coming up to their house, like it was a townhouse, and they received a ramp, as well as some accessibility things in their home, in their bathrooms, on the stairs, those types of things that could support them.
Angela?
Yeah, I don't know much about that, but I'm assuming it's similar to the workplace. You have to have to be able to fulfill the needs and to accommodate your employees, right? If an employee needs change while they are on the job with you, I am assuming the same similar type of scenario would play. I don't, but I don't have those details.
Hmm. And one thing we didn't really distinguish is home ownership versus, rental
Rental.
homes, because that's two different. So what have you seen, Kelly, in your practice, and what do you think of this big emphasis on home ownership in the political sphere, especially?
Well, that's a lot.
Yeah, it is.
People choose to rent for their own personal reasons. There's some people that choose to just say, well, I don't want to own a home. And then there's some people that don't have that access to own a home for various reasons. And there's people that have homes and they're facing housing insecurity as well. So it's not just renters and in this climate, it is also people who have mortgages.
Angela?
And that's correct as well, because we know of people who've sold their homes because they couldn't afford during the time when it was really low rental interest rates, fine. But then the interest rates started to rise, and some people can't cope with the increase in interest rates and what that meant, the difference they have to pay in their mortgages. So they have to look at either bringing people in to their homes, renting space to others, or they would have to scale back as well. So again, that is another area that is causing some angst, but I haven't seen that as much as the renters. I know there's like coming out of the Caribbean, a lot of people want to own their home. That is a thing that you grow up with in the Caribbean. You get married, you own your home, kind of stuff. So I think that is what is playing with people here. When they get here now, it is a difference, because to own your home now, you better have like $200,000 to pay down on a small home if you want, or you're in trouble, right? How many people can save $200,000 in when they're unless they're into cryptocurrency or one of those high-tech jobs right now, right? If you're in your 30s and 40s, you can't really save that much money to pay down, especially if you're a single person.
And there's also, of course, the redlining and the systemic racism with lending. Even if you want to be a homeowner and have the down payment, the banks that go, no, we don't lend to people like you
That's
or
why you have
whatever.
to find bank. You have to have people who are in those places that are representatives of your community, that not that they can make it different, but they can tell you how to go about doing it, because they have systems in the bank you still have to abide by. I'm saying that I worked in a bank previously, so I understand. But they can tell you what you need to get to make sure that you can qualify.
And for the rental housing market, I know here in Quebec, one of the issues has been a lot of people turning their rental units into Airbnb.
Yes.
Yeah.
hmm
Yes.
So what have you seen, Kayla?
Yes.
What have seen is people getting an Airbnb for themselves and renting it out to others at a higher amount and making the money. So they are pretending that they're the landlord or they're the owner of the unit, and they're renting it out and paying the landlord whatever was their agreement. So I've been seeing that a lot in the GTA, where people are misrepresenting and people are fraudulently getting getting their money taken from them for things like this. I've seen that a lot in the GTA in the last couple of years.
Did you have something
Yeah.
to add, Angela?
I haven't seen that on the Airbnb side, but I saw a documentary on CBC that talked about that people who had apartments took them out from being long-term rentals to use as Airbnb, because then they can get more money through that Airbnb. So
Oh
these
my
are people
goodness.
yes, and that was a documentary on CBC something late last year. So that's happened. That's now reducing the amount of rental units, long-term rental units on the market as well. So that's another factor that you have to look at.
That's crazy. Okay, so now with all of these crazy negative things, do you have an empowering message about mental health and housing insecurity?
Well, I have a list. I have a list of some of when I talk about some of the solutions, but
hmm
things we can do to help
Yep.
improve the situation. There are things we talked about. For example, tailoring mental health services to unique cultural needs of the diverse populations like Black, African, and Caribbean, Indigenous, newcomer communities. Really having the mental health services to cater to them, and let them and have them presented by people from their communities. When you have that representation, it makes a big difference, right? Collaborate with, this is government now, collaborate with and fund grassroots organizations, to design programs that affect their lives. So work with organizations like ours to and fund them, because we can't always do it without funding. Some people think that because it's a not-for-profit organization, you should not be working for anything. You should volunteer. I don't know why people think that way, but they do. But again, that can work with these and bring value to those communities. The wraparound services, as I talked about, we need a lot more of those wraparound services and organizations that can work with complex needs, because a lot of these needs are not simple. That's the problem. They are very complex, and we have to understand, the government has to understand, they cannot just do, here's a house. Okay, get you into a house and that's it. No, it's a lot more than that, especially when mental health issues are concerned. Again, connect people to those supports systems, strengthen community connection to reduce isolation. Again, that connection. And here, another one I have is to educate landlords, employers, and public about the realities of mental health and homelessness / housing security, to reduce the stigma and to also increase opportunities. How can we educate? And we talk a lot about some of the things that are happening. How can we have like the hoarding person, or someone? How can we help? How can we educate the landlord to understand what this person is going through, and how can they work with them? But how can public government come in and help him to subsidize something to help that person? Because if it's worse for that person to be out on the street or end up in a hospital, it's going to be more costly. Why not look at something where it can be much where everybody can benefit? Also go back to look at those guaranteed basic income programs that provide a safety net for people. Why not look at something like that again? I know those were looked at over at times and they were discarded. Probably we need to look at that again. I know people are concerned about people taking advantage and not doing, but usually that is a smaller number than those who would benefit from it, that would make use of it in a good way. So there's some of the things I know. One of the other things is expand access to harm reduction programs. And the Ontario government has just announced, I think it was late last year, they sent out to do this, what they call homeless and addiction recovery treatment hubs, heart hubs. So this is another thing. We're looking to see how this pans out, because that should help them, because it's working with them and also with housing. So how can we do more of those programs that that look at things from in all its complexities, and not just looking at something in silo.
Thanks for that, Angela. And Kayla, your closing thoughts.
So there was a question put into the chat. It says homeless people are lazy, violent, criminal, scam. There's a stigma associated with this. Scam artists, dirty. How would we change the mindsets of people about homelessness? So part of doing this is advocating. So kind of, presenting to people and letting them know, this isn't what it is, coming from a trauma-informed perspective as well, could help. Advocacy. So people in my position as a mediator, community services can advocate to the broader public to get them to know that, this isn't what it is. There's different layers, there's some trauma behind it, and those types of things. I also had a little bit of a quote. So I want those who are experiencing homelessness or housing insecurity to remember that your resilience is a testament to your strength, and that your story matters. While the challenges may seem insurmountable, you are not alone. Lean on your community, seek out resources, and never stop advocating for the dignity and the stability that you deserve. So there are people like myself and Angela and Sarah that are advocating for you, but you also need to advocate for yourself. And together we can turn adversity into empowerment and create spaces where we all can thrive.
That is the perfect point on which to end this amazing conversation. Thank you both so much, Kayla Stevenson and Angela Carter, for all of your insights and all the information you shared. I'm sure there are people in our audience who will come away much better informed, much more enlightened, and much more willing also to do that advocacy that you're talking about. Thank you, audience. Thank you, audience, for staying tuned to this conversation. And we hope you will tune in again for another episode of 100 ABC Women Fireside Chats. Thank you very much.
Look how far you have come on your own, but never alone. Through the rain and through the shine, here's your moment. It's your time.